And now it's time for our favorite segment, a segment about universal health care.
Yeah.
We love talking about universal health care. It's really where it all began here at the
Yeah.
Perspectrum.
Yeah. Like literally the entire concept of the Perspectrum is based off of conversations that Michael and I used to have when we were teenagers.
Yep.
And the biggest subject of conversation back then was universal healthcare, was
Yeah.
single payer. So like this is the genesis
Back
of
in the
the
good old
Perspectrum.
days when Nathan would argue that the richest country on earth should be able to give health care to its citizens, that it costs us more and we have worse healthcare outcomes than every other developed nation. And I would argue that that was slavery.
Well,
Sounds
here's-
crazy
here's
when
the-
you say it like that.
Yeah, well, here's the crazy thing though. Like, I've actually seen Rand Paul make that argument,
Oh, sure.
and as a guy who gets government-funded healthcare,
Yeah.
like the dude has government-funded healthcare. Basically, what you were saying, if you were comparing single-payer, the government-funded healthcare, if you were comparing that to slavery, you were saying that you, as a senator who is benefiting from government-funded healthcare, are benefiting from slavery. Like,
To be fair, he also argues against reparations, I assume. So
that, yeah, that's a
twice
good
over,
point.
I guess.
Yeah. So I want to start out by doing one of our favorite things, which is a steel man.
Nice.
So let's go ahead and steel man the anti-Medicare for all argument. And I actually, I read, in preparation for this, I read an article from the Hoover Institute, because as we know, historically, we should always listen to Hoover, that laid out a lot of the essential counter arguments. And some of them are ones that you've probably heard before. So we're gonna go over them and we're going to address them. So first off, the biggest argument that we often see against the concept of universal healthcare is the intuitive one. If you cover everybody, it is going to be more expensive. Now, when it comes to healthcare, you have three areas to consider. Number one, you have quality. Number two, you have potential universality. And number three, you have cost. Now, what the argument is basically that you can have two of those, but you can't have all three. So you can have universality, you can have a low cost, but if you have those two, then you can't have high quality. Or you can have high quality and you can have universality, but if you do that,
It costs you a lot more money.
it's going to cost you a lot more money. So by its very nature, creating some type of single-payer healthcare system is going to end up costing us more money in the long run. Another argument, and this is one that we hear repeated all the fucking time, is specifically wait times. All right, that's the argument that the right loves to lob about universal healthcare. If you try to accept universal healthcare, then oh my God, it's going to result in astronomical wait times. There is actually some level of truth to that. When looking at wait times measured as waiting more than 1 month to see a specialist, and this is the most recent numbers we can see are from 2016. One of the things that we actually can see is that on that list of countries ranked in the percentage of time it took more than a month to see a specialist, the United States is actually pretty low on that list. And in fact, the only countries on that list that specifically includes various wealthy OECD countries, the only countries that are actually above the United States on that list are countries like Switzerland, Germany, and the Netherlands, which none of which have single-payer systems. They all have what's called a health insurance mandate system. And in fact, the next country that has a single-payer health healthcare system that is ranked on that specific list is France. Now, the United States, 27% of the time, people have to wait more than a month in order to see a specialist, whereas France, which again is the next lowest country that has a single, that happens to have a single payer healthcare system, is 36%. So 36% of the time you are waiting more than a month to see a specialist, which again is intuitive. If you're covering everybody, then that means that the healthcare system is going to be so flooded with people that you're gonna end up having longer wait times, and people are gonna have to go a long time without potentially getting their cancer treatments or whatnot. But even if you do try to have a system of single payer that doesn't cost an astronomical amount, the third argument is that is going to substantially lower the quality of your service, because by its very nature, you're going to have to cut costs on doctors. You're going to have to go for less high quality drugs, less high quality pharmaceuticals. You're not going to be paying for the best, because if you can't afford to pay for the best, you're not going to get the best. So for those reasons, it is absolutely clear that the idea of going for a single payer healthcare system would cost more. It would lead to lower quality. It would lead to more people dying because of the astronomical wait times. And for that reason, Bernie Sanders is absolutely ridiculous, and progressives need to shut the fuck up. So here's why that's bullshit. So first off, let's address the quality. The idea that, all of these single-payer healthcare systems have lower quality and less good health outcomes than the United States, which is actually an argument that was stated in that Hoover Institute article that I read. Let's look at the actual facts. So when we're looking at countries that are OECD countries, so these are like the 13 wealthiest countries and considered the most developed countries in the world. When we're looking at these rankings, let's look at their health outcomes in various different areas and see where the United States ranks. So again, there are 13 countries on this list. In terms of life expectancy, the United States is ranked 13. In that we have the lowest life expectancy of any of these other countries. And in fact, one of the things I think is interesting is that the distance between the United States and number 12 is about 4 years.
Jesus Christ.
Yeah. Which is the same distance between number 12 and number 1, which is about 4 years. So number 12 is Great Britain. Number 1 is Switzerland. And yeah, the difference between the United States and Britain, which again, Britain is number 12, the difference between them is about 4 years. The difference between Britain and number 1, which is Switzerland, is also 4 years. Which also means that Switzerland has 8 years higher life expectancy than us.
That is so huge.
Yeah.
Especially because in the United States, we also can't retire until we're like 65. Right? So the difference between dying at 72 and 80 is so, it's so important.
Yeah. In terms of infant mortality, United States is ranked 13th. We're the worst. In terms of unmanaged asthma, we are ranked number 9 in our ability to manage it, in terms of the worst. In terms of unmanaged diabetes, we are ranked 13th. Again, at the very bottom of the list. Safety during childbirth, 13th. Heart attack mortality, 11th. So we're at the bottom of every single one of these measurable lists in terms of our outcomes. So look, there's a lot more to go over in terms of arguing what would be a good system or what would not be a good system. But anybody that tries to make the argument that our current system has better quality outcomes than single payer countries is just fucking wrong.
Yeah.
You're just incorrect on the facts.
Yeah.
Right? You can, this doesn't automatically prove, like just these numbers doesn't automatically prove that the cause of these better outcomes is single payer. We'll get more into that to begin with. This doesn't necessarily prove a causal relationship, but to say that the United States has better health outcomes than than other countries that have single payer systems or mandates,
Yeah.
you're just fucking wrong.
Yeah.
We don't. We
I
just
think,
don't.
And I think the diabetes and asthma stats are particularly interesting because these are chronic. So they're the kind of things that you have to manage. That is how you take care of them. But because of the cost of our system, they're the kind of things that get neglected and lead to worse outcomes, not only health-wise, but also cost-wise later on. So according to an analysis from KFF, 1 in 4 adults put off needed healthcare because of the cost, and 1 in 5 adults haven't filled a prescription because of the cost. And health insurers often actually discourage treatments and care to help hold down costs. And they'll often have these convoluted systems that require people to go through like different kinds of medication that physicians know won't work in order to get more access to more expensive medications. And that has a high degree of abandonment among people trying to treat their illnesses. So one survey found that 78% of physicians reported that this led to people abandoning recommended treatments. And 92% thought it contributed to delays in treatment. And so we just have this terrible, like, vicious cycle, especially when it comes to chronic illnesses.
Also, I want to get a little bit deeper into that number. So Michael mentioned that 1 in 4 people have gone without health insurance, or rather without health care, citing costs as the reason. Now, real quick, I do just want to interrogate that number for a second to kind of juxtapose it with the number from earlier, and to make a point about the idea of wait times, right? So when it comes to healthcare, when it comes to wait times, we did acknowledge the fact that wait times in countries with a single payer healthcare system, on average, do tend to be higher than countries that have either a health insurance mandate or, whatever the fuck you can call the United States. That is technically true. All right. So, let's juxtapose the United States and France in terms of those numbers. So the United States, 27% of Americans have had to wait more than a month to see a specialist. And France, which that number is the lowest among single payer healthcare systems, that number is 36%. However, we do also need to acknowledge the fact that in the United States, you have about 25% of people just straight up not like going without healthcare at all because of cost.
Yes.
And that number is 0 in France.
Yes.
So when we're talking about rationing, well, there's rationing in all countries. There's rationing in the United States. That is a form of rationing. And another thing that we need to point out about that, another thing that we need to make sure that we acknowledge is that although, as Michael pointed out, although 25% of people have cited cost as the reason for going without healthcare, that number becomes 61% when we are talking about the uninsured population. And the uninsured population in the United States, because we do not have a universal healthcare system, the uninsured population is 7.9% of Americans, which is 26.2 million Americans.
Yeah.
So of those 26.2 million Americans, 61% have cited cost as a reason for going without necessary health care.
Yep.
So that point right there, although I would say that of all the points against single payer healthcare, the point about wait times is probably the strongest point. That I would say is the best counter argument.
And I totally agree that point is one of the stronger ones. And I think in combination with trade-offs that you can face between universality and cost and quality and that kind of thing. But I think if we think about wait times from an economic perspective, I think we pretty quickly realize that the alternative is totally absurd and insane. So, like, the alternative to a structure that is that has universal coverage and longer wait times, relatively speaking, is one in which we have shorter wait times, but then non-universal coverage. And so if we think about, let's think about supply and demand, right? Because the only reason why we have wait times anywhere is because we have a mismatch between the amount of available, doctors that are able to supply these services and the demand for those services. But we're talking about healthcare. We're not talking about fucking purses. Healthcare is something that is, not only is it like a true requirement, but it's also not something any of us really want to seek out, if that makes sense. It is like something that we either need to seek out or know that we should seek out. And basically everybody is trying to receive the minimum amount of viable healthcare. So falling below the amount of healthcare that people are voluntarily seeking out means that people are not getting healthcare that they should be getting, which means that we can't solve the mismatch in supply and demand by reducing demand, because that literally shaves years off people's lives and worsens health outcomes. So the only path forward here is increasing supply or accepting wait times. There just isn't a humane path forward where we solve this economic imbalance by reducing demand. Demand is already at the lowest level that is in the United States. Demand is lower than it should be because people are forgoing healthcare in order to save money, and that's what's leading to wait times that are shorter than countries with universal care. So it is just not a tenable solution that we compromise coverage in order to shorten wait times.
Yeah. And let's address the point about cost. So the other claim is that if you go for a single payer healthcare system, then you are just going to drive up the costs of healthcare. You're going to end up with massive amounts of increase in the amount of money you're going to be spending on healthcare.
Yeah. Mm-hmm.
Per capita, not when you're adjusting for population. We spend the highest amount per capita of any other country in the world, any other developed country in the world. All right, the United States spends $13,432 per capita as of 2023. To put that into perspective, the next highest in per capita spending is Switzerland. Switzerland has spent $9,688. Now, yeah, that is a large amount, and that is in Switzerland. They spent that, and it was significantly higher than the comparable country average, which was $7,393. However, it is important to note that Switzerland actually yielded decent outcomes from that. Switzerland has the highest life expectancy in the world. They're actually getting bang for their buck, whereas we right now have the lowest expectancy of any other of the major developed countries. We have the lowest life expectancy, and we are paying more. Like the best way to sum up our entire healthcare system is basically just to say we are paying more and we are getting less. Now, let's look at some of the reasons in which we are paying significantly more.
I do want to just double down on that point too before we move on to like the drivers of that thing. Again, just back to like I think this argument that like, oh, if we give people free healthcare, we'll have this runaway cost problem. And to your point, Nathan, like that isn't borne out in the data, but it's also not even intuitively true if you move past just the first order thing. We're not talking about a consumer good here, where once you reduce the cost of it, people try to hoard it and like, and people will go and consume it extravagantly and stuff like that. We're not talking about, even necessarily like discretionary procedures. We're not talking about people going out and getting a bunch of like cosmetic surgery covered by universal healthcare. There is a exact right amount of care that people should be getting, and that is the amount that they will likely want to seek. Just because it's low cost doesn't mean they're going to spend all day waiting around to like go to the doctor or whatever. They're going to just get the care that they need. So there's just no reason why we'll have these runaway costs driven by people getting universal coverage.
So let's talk about what some of those drivers of the cost are and how they could be potentially offset by a single payer system. First off, one of the big drivers of it is the cost of administrative care, or the cost of administration. Mm-hmm. Because of the fact that doctors have to spend excessive amounts of time on the phone with insurance companies, the fact that we have insurance companies that have to go through, okay, is this covered? Is this not? Is this person going to die? Are we going to let them live like in our arbitrary room based on, whether or not they, based on whether or not they accidentally had a doctor that wasn't in network or whatnot, how, all of that. So as it stands, among the OECD countries, the United States spends the highest per capita on administrative costs, $1,001. To put that into perspective, the next highest, the next biggest spender is, again, Switzerland, with $392 per capita, over $600 more per capita than the next country. And the average is $213.
Jeez. So literally, like approximately 8% of the cost of healthcare in this country is consumed by how much fucking paperwork it is to get healthcare in this country.
Exactly. And one of the things that's important to note when you look at the OECD average, or rather the OECD countries, the countries that have single payer are the ones that, most of them are the ones that have significantly lower administrative costs. For the most part, the ones that have insurance mandate systems tends to have higher ones. Now, there are exceptions to that. Japan is actually the lowest on the list, and they have a mandate system, and they only spend $74 per capita on administrative costs. Which, holy shit, that's
crazy. That's amazing.
That's fucking impressive. And considering the fact that Japan is pretty high on the list in terms of outcomes on most of those things that I said earlier, they're second in life expectancy, first in infant mortality, or I should say in the least amount of infant mortality, first in the least amount of unmanaged asthma, first in the least amount of unmanaged diabetes. A little bit lower on around the middle in safety during childbirth, number 7, and first when it comes to combating heart attack mobility. So actually, looking at this, I think at some point you and I should spend some time and maybe do a policy deep dive where we focus on the mandate system. Because a lot of conversation in the United States focuses mainly on single payer. And I think that the reason why single payer would probably be more practical in the United States than that mandate system is because there is some infrastructure in place, like the Medicare system that we have, or potentially the Medicaid system. I've also seen proposals that would do proposed ideas of Medicaid for all. But the point is, as it currently stands, we spend an inordinate amount of money on administrative costs, and that is a huge portion. To Michael's point, about 8% of our entire costs is just fucking paperwork, basically. So the reason for why all of that stuff costs so much is because the United States has absolutely no bargaining power when it comes to trying to negotiate those prices. For one thing, we have a government that's basically just bought and paid for by, the pharmaceutical industry and the industries that design medical equipment. So they never even attempt to try to to try to negotiate prices. And to the extent that they do, remember the Biden administration like basically celebrated the fact that the Inflation Reduction Act reduced the price of pharmaceuticals for like a few drugs. And we've already talked about in the past, one of the reasons why pharmaceutical drugs cost so much in the United States is because we front the risky investment. Like the taxpayer fronts the risky investment up front, and then these corporations basically sweep in, buy the patents once a drug is shown promise, and they jack up the prices, and then they buy the government to make sure that they have the ability to, number one, continue to buy the patents, and number two, be able to set the prices whatever the fuck they want.
I think that's such a key point, because an argument that you constantly hear about in a single payer system is on the pharmaceutical front, it will reduce innovation. That is the argument against this, against like the government negotiating drug prices or whatever. And there's just not a reason why that is actually true, because to your point, in large part, the most risky part of the innovation thing is funded by our government anyway.
Which arguably that would be the most innovative part because it's the most risky part. So that's complete bullshit. And another reason why single payer would actually help would actually help bring down cost is because if there's only one payer, then that payer has significantly more power in negotiating the prices of care, right? Now, when you have multiple different private insurance companies that pay for the care, that gives the people that design drugs and medical equipment significantly more power, because they can just say, all right, well, we're going to raise the price, and if this insurance company decides they don't want to pay for it, or this insurance company decides they don't want to pay for it, well, there's 1,000 other insurance companies that are going to pay for it. So fuck you. So that's a terrible point. All right, the idea that it raises the prices that it raises prices overall, it's just not borne out by the facts. And in fact, The Hill, according to The Hill, back in 2020, it talks about a professor from the University of California that basically compiled a study that examined 22, an analysis that compiled 22 different studies about the projected cost of single-payer health. And what they found consistently was that it saved money. All of them, even right-wing think tanks. There was one by the Mercatus Center, which is a right-wing think tank, and even they found that $2 trillion would be net saved within 10 years. And that's one of the lower estimates. There was a study done by a bunch of professors at Yale that was published in the National Library of Medicine that actually found that approximately $450 billion would actually be saved annually. All right, $450 would be saved annually with a Medicare for all single-payer system. Because of all that it would save on administrative costs, because it would make it easier for us to actually negotiate with providers, because of all of that, it would actually save a significant amount of money than what we're paying now. Now, might that mean that there might be tax increases because that money is now going to be coming not from private insurance companies but from the government? Perhaps. But, I mean, if I were to tell you, all right, you may have to pay an extra, let's say $500 every year in taxes. All right, let's say that you have to pay an extra $500. I don't know if that's a number, but let's assume that's a number. All right, you have to pay an extra $500 in taxes, but you're going to save like upwards of $5,000 per year because you no longer have to pay into a health care premium. All right, which one are you going to take?
Yeah, exactly. Like, I spend way more than that between, that's the thing. I spend, and you listener probably also spend probably thousands of dollars a year, not for health care, but for health insurance, which may or may not come with healthcare.
Yeah. Yeah.
Totally. I think I think those are really strong points. On top of that, there's like a lot of other potential economic benefit from the second order impacts of improving our healthcare system and improving the and lowering those costs and shifting those to like a more centralized system. So one like really interesting analysis done by the Penn Wharton School of Business put together a relatively complex like multivariate model on not only the first order impacts of like this healthcare system and its costs, but also those second order impacts, making assumptions about like how people will respond in their employment opportunities if healthcare is no longer tied to their employer. Things like the opportunity to, or the lowered risk that comes with being able to switch jobs because you have like your health insurance like not tied to that employer anymore. And one thing they found was that under a single payer system, average life expectancy just from like the shift in the system would increase by about 2 years and would grow the population by approximately 3% and increase worker productivity and health and provide a bunch of macroeconomic benefits. Now, it was one thing that was interesting about this study is like they did some analysis on how we fund this system because they were curious about whether their model would predict that the way we funded it would vary its outcome. And they found something kind of interesting that I'm a little dubious of, but I think is worth talking about. So the analysis found that the thing that captures the most economic benefit and health benefit and economic growth is a system where it's actually funded by a flat premium for everyone, where basically everybody pays in X amount of dollars for health insurance. Everybody gets, except for retirees who pay less, everybody gets like the same coverage. And people that can't afford that have a maximum, right? And like basically there's a Medicaid system that steps in to cover it for low income people. And they found that was like the best way to fund it according to their model. Now, I'm a little bit skeptical of that. One of the things they compared it to was a payroll tax system where it's similar to a progressive tax system where the more you earn, the higher percentage of your income that you pay. And basically that goes on top of all of your other payroll taxes. And they modeled this and found that it could lead to up to a 3% shrinkage in our economy, right? However, as I talked about, in a complex model like this, you're making a lot of assumptions about these second order impacts. And one of the things that they assumed is that under a payroll tax version, like payroll tax system, there will be some level of worker like self-selection out of the economy or reduction in total work for workers in the economy because their health insurance will be, linked to how much they earn. So if they earn less, they get the same coverage, but they have to pay less in health care. I'm super skeptical of this because I just don't think that's how any of us make decisions about how much money we should earn. Like, I don't know anybody that, aside from maybe the very wealthy, who actively sacrifice the vast majority of their income and wages for a small minority of their taxes, if that makes sense. So, like, I think this is probably an overblown estimation, but I think it's like worth noting that even in like the worst case, we're extending life expectancy and like it has the potential to drive some significant economic growth and increase worker productivity and all of these other second order benefits, aside from just the fact that people are not going to be like waiting for an emergency to seek medical care.
One argument that I didn't mention during my Steelman, because I think this argument is so ridiculous on its face that like I would be doing the Steelman argument a disservice by including it, is the idea that you'd be sacrificing choice in a single payer system. Now, this was the favorite argument among conservative Democrats during the the 2020 primary. Oh, if you go for single payer, you're going to be taking away people's health insurance, which is basically just taking away their choice. All right. That is such a fucking stupid argument.
Yeah.
And it is so easy to disprove with just simple ass logic. All right. So let me ask you this, listeners. What do you think, what choices are more important for you to have when it comes to your health care? All right. Would you rather have the choice between who your doctor is, what types of services you're going to get, which hospital you're going to go to? Would you rather have that choice, or would you rather choose if the money that you use to pay for it comes out of your left pocket or your right pocket? Because here's the thing. You don't have choice in our current system because we have networks, all right? Insurance companies have networks where some things they will cover and some things they will not cover. But if there is a single payer, there is a single network, which means you no longer have to choose who your doctor is based on who is in network. You can choose whoever the fuck you want because there is only one network. Literally, the only so-called choice is who you're being fucked over by, all right?
Yeah. Exactly.
Because under a single payer Medicare for all system, there is no premiums, there is no deductibles, there is no copays. Your choice, the choice that they kept defending, are basically, oh, well, what would you like your plan in terms of how many, how much your premiums or how much your copays or how much your deductibles or what your out-of-pocket max is going to be? Like, what would you like your choice to be for that plan? Well, again, in this system, you don't have to worry about any of that because you don't have premiums or deductibles or copays.
Yep.
You
Exactly.
don't have to worry about meeting your out of pocket because like you've already met your out of pocket because that's just your taxes.
Totally.
All right. So the rest of it is all covered and you can choose wherever you want to go. Choice is significantly increased in a single payer Medicare for all system. It's such a ridiculous argument on its face to say that you are depriving people of choice by having a single payer system.
Yeah, absolutely. It's like not only is the decision about do you want to pay for it from your left pocket or your right, like I think that's a great analogy because like today your health insurance is tied to your employer and most of us don't have 30 employers we get to pick from. So that's already reducing the potential choices that you have. And then once you get down to the choice, which in this analogy is the pants that you're wearing, it's like, okay, you're right. If you pay for your right pocket, you get to go to these doctors. If you pay for your left pocket, you get to go to these doctors. And both of the pockets are empty and they don't pay for anything anyway. So yeah, I think that's such a great point. And like the question of do I get to keep my doctor is a reasonable one as we think about transitioning to a Medicare for all or a universal healthcare system. Because ultimately, like, that's up to your doctor if they're going to keep treating people under this system, right? Like, that's up to them.
Yeah.
There's no way for us to decide. But, like, I'm sorry, you getting to keep going to that same doctor, that's the thing. The counter argument to that is, like, forcing doctors to do work. And that's something that no one wants. It's literally one of the straw man arguments that they try to defeat with about like I referenced at the beginning of the segment, like pretending that universal healthcare means we have to develop forced labor where we force healthcare practitioners to do healthcare, which is just not the case at all. No one's proposing that. And
by that logic, teachers are slaves.
No, exactly. The slavery argument is absurd because, like, declaring that there is a right to a good that is present in the economy is not the same thing as declaring that someone is obligated to produce that good, right? We are talking about dividing up something that is present in our economy and the most just way to divide that stuff up. If tomorrow all of the doctors quit, then yeah, we wouldn't have healthcare to divide up. But the fact that we have plenty of healthcare and that some people get it and some people don't based on a bunch of accidental factors that have nothing to do with whether they need healthcare or not, is just totally disconnected from like the reality of the situation. It just is the case that we have the availability of healthcare, and we should decide how we want to split it up in the most just way.
And look, the last point that I want to make, and for me, this is the most important point. For some of you, it might not be. But for me, this right here is the big kicker. That same study that I cited earlier from colleagues from Yale that was published in the National Library of Medicine, that study estimated that if we implemented actual universal health care for all Americans, it would save 68,000 lives every year.
Yeah.
That's 68,000 people that did not have to die because we have an archaic, corrupt healthcare system that only benefits a bunch of wealthy insurance companies whose only job is to get between you and your healthcare provider, to cause unnecessary barriers between you and your healthcare provider, and to jack prices up as much as they possibly can, and to have a financial incentive to not give you the service that you paid for.